Good afternoon, everyone. Thank you all for joining us today in this special web event sponsored by Iraq and Afghanistan Veterans of America and the Mental Health Alliance of New York City. My name is Jason Hansman. I'm the Senior Program Manager for Health Programs at IAVA, and I'm joined today by our moderator, Scott Thompson, the Assistant Director of the Traumatic Brain Injury and Emotional Wellness Alliance.
Good afternoon, everybody. Again, my name is Scott Thompson, and I work for the Mental Health Association of New York City. MHA of New York City has for 50 years been innovative and responsive to addressing mental health needs, including those of veterans. The Mental Health Association of New York partners with SAMHSA and the VA to administer the Veterans Crisis Line, as well as directing the Veterans Mental Health Coalition here in New York City. And this is it's a 1,000-member coalition that promotes the mental health and well-being of New York City service members, veterans, and their families through education, information, collaboration, and a promotion of a whole range of comprehensive services. And finally, our reason for being here today, in May 2012, in order to raise awareness about traumatic brain injury and its mental and emotional impact, the Mental Health Association of New York City launched the National Traumatic Brain Injury and Emotional Wellness Alliance to unite the collective efforts of essentially three communities: athletes, veterans, and science. There are 30 members on each of these councils, and we're honored to be partnered and in collaboration with the IAVA for our Veteran Leadership Council. And the goal of this entire emotional TBI and Emotional Wellness Alliance is to increase awareness, disseminate some of the best science-based information, and advance policy and advocacy initiatives around traumatic brain injury and its mental health impact. And today's webinar, which I again thank all of you for joining us, is part of raising this awareness. We're joined this afternoon by Dr. Ron Savage from our Scientific Council, and by Dustin Shyrock from the Iraq-Afghanistan Veterans of America. Dr. Savage has worked with children, adolescents, and young adults, and veterans with traumatic brain injuries and other neurodevelopmental disorders for the last 35 years. He's the past chairman of the North American Brain Injury Society, chairman of the International Pediatric Brain Injury Society, board of governors for the International Brain Injury Association, and executive steering committee for what's now called the PABI plan, which is the National Pediatric Acquired Brain Injury Plan. And finally, he's also the editor-in-chief of the Brain Injury Professional Journal. Dustin Shyrock comes to the Iraq-Afghanistan Veterans of America from the finance industry. He initiated his financial services career by co-founding a small fund that specializes in new issue equities, including IPOs and secondaries. Prior to his university degree, Dustin spent 5 years in the United States Army, where he served as an intelligence analyst, spending 3 years operating in Baghdad, Iraq. And he was awarded the U.S. Army Bronze Star Medal for exceptional and meritorious service. And he received his Bachelor of Arts degree, Environmental Studies and Economics, from Pace University, where he graduated just recently in 2012 after an internship at the White House. He's currently attending New York University's Robert Wagner Graduate School of Public Service. So Dr. Savage, Ron, and Dustin, thank you both for being with us today. Be glad to start by just asking each of you how you came to this subject today, how you came to the subject of traumatic brain injury, and a little bit of your path in joining us for this conversation.
I'll be glad to start. My work over the years has been really focusing on younger people that have had traumatic brain injuries, and obviously this includes a lot of kinds of things like everything from car crashes and falls, sports injuries, those kinds of things. And as you cited, Scott, in some of my credentials, you hear the word pediatric a lot. But what we're including in that population is basically children, adolescents, and young adults up around age 25 and 26, where in my experience we have been able to collect a lot of information over the years regarding what works treatment-wise? What happens to a young person or a young adult after a brain injury? And what does that mean in terms of their development throughout life? So my role over the past number of years has been to work with a variety of professionals, develop programs for people, and including different kinds of supports and services that are not only hospital-based but also community-based.
Great, thank you. And Dustin, perhaps you could share a little bit about how you came to this subject and conversation today.
Yeah, you bet. So I came to this subject by simply being involved with this organization, by working here. And by working here, we deal with so many different veterans issues kind of widely across the board that TBI is certainly one of them. So here I am speaking about it today. The other aspect is I didn't ever discuss TBI when I did not work here. So again, working here has kind of brought out the idea of speaking about it and making sure that people in my shoes that were not involved with a veterans organization are having these conversations as well. Whatever industry you're in, whatever educational program you're in, I think it's important to hear about it and not gloss over the fact that so many people do have it, and not just in the military. I think it's an important conversation.
Great, thank you. Ron, I wonder if you could start also by just giving us a broad overview of traumatic brain injuries, some of the interventions, and from your perspective, some of the current state and challenges of traumatic brain injuries.
Yes, thanks, Scott. You know, what we've been looking at over a number of years is what we call incidence and prevalence. How many traumatic brain injuries are there out there? And through the Center for Disease Control and Prevention, we have also been able to better define traumatic brain injury, basically as an external physical force, something that impacts the head and brain. And sometimes it's not just an impact, it can also be a violent shaking. And that injury to the brain itself can cause disruption in a number of areas: cognitive issues, behavioral issues, physical sensory motor issues. And currently in the United States, we're seeing about 2.5 million people per year, according to our CDC data, that sustain traumatic brain injuries. And there's another group of sort of what we call the concussion, the mild traumatic brain injuries, is actually a little bit higher than that. And what's interesting is we've looked at the number of veterans coming back with head trauma, many of it due to blast injuries, but the numbers are now approaching 285,000 service members that have sustained brain injuries in Iraq or Afghanistan. That being said, what that has done is make us look at traumatic brain injury a little bit differently, since what we're finding is that the treatment for people coming back with traumatic brain injuries from a military perspective is slightly different than it is from a civilian perspective, say for people injured in car crashes.
Great. Dustin, did you want to pick up on any of that?
No.
Okay. Dustin, a question for you. You had said earlier, I appreciate you sharing that before working at the IAVA, you did not talk about traumatic brain injury, and now being here, this has been something it's been important for you to share. And I appreciate you're willing to share some of your own personal experience with this. And can you share a little bit of your story with us?
Sure, absolutely. So I was anticipating this question more or less, and I think it's important to know how prevalent and how easily one could be affected by a TBI. Being in the military, you don't necessarily need to be an engineer clearing a road, or an infantry person conducting a patrol, or a ranger doing a night raid. I was an intelligence analyst. I was behind a computer, minding my own business, more or less, and we took rocket strikes quite often. One of those rocket strikes actually hit our building, and that kind of set me up for where I am now. During that time, we had quite a few people in the building sustain very serious injuries. Mine being less physical and more internal. However, this happens, widely across the board with the military. So I think it's just important to know that a TBI can be sustained numerous ways while being forward deployed somewhere. So once you realize that, you can also begin to pick up on who do you treat when you have soldiers and Marines coming home. I think you have to treat everyone and at least start the screening process very widely across the board, because what you do in combat doesn't necessarily dictate what your outcomes will be while you're there. So that's more or less my story of how, I won't go into too many details on who I was and what I was doing there and how I did receive my injuries. Now, granted, I have very mild effects of certain things that happened in Baghdad, but still very important, still very life-changing effects.
Thanks, Dustin. I appreciate you sharing some of that. Ron, I wonder if you might just talk a little bit about some of the complications, some of the problems, both short-term as well as long-term, that can develop after acquiring a brain injury.
We talk about brain injury from a medical definition point of view in terms of mild, moderate, and severe brain injury. And I think Dustin just gave, I think it's an important point that even with a mild brain injury, or in the civilian sector, something that we might describe as a sports concussion, we certainly have been aware of what's happening in the NFL, other college sports, people sustain concussions, and it can be long-term. Quite honestly, the best definition of mild traumatic brain injury I've heard was from a professional athlete. He said it's only mild if it happened to you. And that being said, when you look at what Dustin has experienced, or some of his other service members that had more severe brain injuries, it can have a long-term and devastating effect. But when I say long-term, I'm talking about throughout the lifetime. We have certainly looked at, and again, I'll compare it to the NFL players, we have certainly looked at the development of this thing called CTE, chronic traumatic encephalopathy. And what happens there is people go into early stages of dementia and Alzheimer's a lot sooner than they should. But the other thing that's been perplexing to many of us in the civilian sector, working with people with brain injuries for years, is the traumatic brain injury can develop into a chronic condition. And by that, I mean it's almost disease-like. Other things can develop: depression, psychiatric disease, orthopedic problems, neuroendocrine disorders. There can be a host of things, not just including being able to live on your own independently or to work, but there's a lot of other health conditions that can develop over time after a traumatic brain injury. And so when we're looking at people with a traumatic brain injury now, we just don't look at it as you had it, if we give you rehabilitation, we made you all better, and everything is okay. This is for many people, unfortunately, this is a lifetime experience. And I'll just conclude with, my grandmother used to say to me that time heals all wounds. And it seems with traumatic brain injury that over time, traumatic brain injury reveals all wounds. It can worsen if the supports and services aren't there.
Great, thank you. Dustin, I wonder if, as Ron was saying, that there are often mental health challenges related to even mild traumatic brain injuries, and I wonder if you might be willing to share a little bit of some of this struggle yourself related to your own traumatic brain injury.
Yeah, sure. I'll share some of the things I'm more comfortable talking about. And granted, this is maybe the second time I've even discussed this injury with pretty much anyone. Immediately, the symptoms became very clear. I had no sensitivity to sunlight my whole life. And basically immediately after the incident, my sensitivity to sunlight was astronomical. I couldn't walk outside without completely having swollen eyes. That has subsided over time, but the intensity is still there with any kind of bright light. It's almost debilitating sometimes. I've had, different doctors tell me it's different things. However, I attribute it to that. But get it back into the discussion here. Long term, what I've noticed, I went from very organized and very clear-minded to having extreme difficulty organizing my entire day. Whereas before, that was such an easy task for me. It became daunting as I couldn't prioritize, more or less. Is a better way to say that. My priorities became very skewed on what was important, what was definitely not important to be focusing energy on. And so that's something I've been combating for a while now. And I do have excellent programs in place to keep me organized and to assist with that. However, that is one of the things I'll probably struggle with forever now. Another one was clearly speaking. I still have a problem with it now. I had very clear moments of I had moments of clarity all the time. I could conduct myself in briefings very well. I could very easily organize my thoughts and what I wanted to say. That to this day is very difficult. It takes a great amount of time and prep for me to write down exactly what exactly what the message is I want to be giving. So that that could be done in my head. Now that's done on pen and paper or an iPad, which that's fine, but that's just one of the other struggles that I'll assumingly have to deal with forever. So those are some of the more prevalent things that I'll talk about, and I'll kick it back to you.
Yeah, thank you. Thank you very much, Dustin. Ron, related to this, you indicated, in addition to some of the challenges cognitively with memory and things, there's been some confusion between some of the symptoms of a brain injury that actually end up looking a lot like post-traumatic stress. We've been hearing a lot about that. I wonder if you could share a little bit about some of the differences and some of the similarities between a traumatic brain injury and post-traumatic stress.
It's been one of the things that I think has been most, again, confusing for clinicians working with veterans coming back with traumatic brain injury and PTSD. We certainly know in the civilian sector we'll have people that are in car crashes or assaults, say, for example, and they'll have PTSD afterwards. But there's something different about what we're seeing in a lot of our veterans. Many of us think that, obviously when you're in a combat situation, you're in a war zone, the brain is in a heightened condition. And that may make it obviously more susceptible, not to traumatic brain injury per se, but to the stressors afterwards because of that heightened time that the brain is in, and then it sustains an injury. We have these two conditions. We have traumatic brain injury, which is obviously a physical, neurological condition, if you will, diagnosis to the brain. There's been an injury to the brain. But PTSD is a mental health issue. And so when you look at these, you say, okay, now I've got a physical issue and I've got a mental health issue. And we can separate them out as clinicians into sort of like two easy piles. Here's a traumatic brain injury. You injured this part of your brain. You injured those frontal regions, as Dustin was so eloquent in terms of describing his situation. That planning, that organization, that initiation, those frontal areas, those are impacted because of his brain injury. But then you put on top of that the PTSD, this emotional side, heightened anxiety, wanting to withdraw from society altogether, all of those things that go along with post-traumatic stress disorder. One of the better papers that I have seen actually written on this was by Marilyn Lash, and I know that we're going to put links on for our listeners today. But if you look at brainlinemilitary.org, you'll find a nice description of the differences between traumatic brain injury and PTSD. The issue for veterans, though, is that while I can sort of put one in one pile and one in the other pile, the veteran has both. It's very hard for the person themselves to sift and sort through what is this versus what is that. And to be quite honest with you, a lot of the people that I've had the good fortune to see and to work with, they have been misdiagnosed. There have been situations where I've seen people go through that have depression after their traumatic brain injury and have PTSD. And they'll go through treatment, and then someone will say, well, the treatment didn't work for them. I treated them for the PTSD, and it didn't work, without realizing that on the brain injury side, they have memory problems. And so you work with them in a session, you bring them back the next week, and they don't remember the strategies and the things that you worked on. That memory part that goes along with the brain injury. So, you know, it kind of just, again, just to give you another sense of this, when you look at brain injury, you're talking about that physical condition. You look at PTSD, you're talking about, you know, in the arena of mental health. But when they combine, they present a whole different clinical pattern to us in terms of how best to provide treatment for the person. And we don't have it all figured out yet, to be quite honest with you. I think it's been confounding, but what we do want to do is to make sure that if a person has PTSD, we also look very closely to whether or not there was a traumatic brain injury. No matter how mild it was, it can complicate the treatment for that person unless we know about it.
Great. Yeah, thank you. Thank you very much, Ron. We have a question from one of our audience members on the Google Hangouts, Diane from Liberty Resources. She's asking, and this perhaps for both of you, maybe Dustin from some of your own personal experience, and Ron, can either of you comment on the prevalence of substance abuse within the traumatic brain injury population, and what types of treatment work best for individuals who are dealing with this issue? And I'm just assuming that perhaps people may have had a concussive blast or an injury to their brain and may not have known it, but find themselves trying to cope in many different ways with some of the impact of that. And I just wonder if both of you might be able to address some of that.
I'll just, maybe start it again, because I really want to hear what Dustin has to say about this because of, his relationships and other friends. But yeah, certainly with veterans with traumatic brain injury, unfortunately, this is very common. It's also common in the civilian sector. It's been something that we've known for years. One of the things we have in the U.S., we've had it since 1987, is what we call traumatic brain injury model systems. We've collected information on thousands and thousands of people, and we find that the substance abuse is very high. And sometimes people report it as self-medication. Sometimes people report it as just trying to quiet the noise that's around them, escape, etc. But if you don't combine it with the therapy, in other words, if you have a traumatic brain injury and you have a substance abuse problem along with it, you have to treat both at the same time. They are both in the person, if you will. And just like I gave the example before, I know that AA is a good program. But AA and all of its steps don't work very well if you have memory problems and can't remember the steps. So there has to be a combined program, and I think that's where we've missed the boat sometimes in terms of working with not only with veterans, but civilians with brain injuries, as we have looked at this as a singular event that maybe one profession could treat and make better. When we know now, at least in the civilian sector, and I think in the military sector as well, that you really need an interdisciplinary team to be working with this person. But substance abuse in both veterans and civilians is very high, unfortunately, after a brain injury.
Thank you. Ron, I'm just curious, Dustin, since you've been working at the IAVA, you've been talking, about this, and I wonder if you have maybe anecdotes of some of other service members that you're in contact with about coping, adapting through perhaps substances, other ways that people have coped. I wonder if you might share a little bit with us.
Sure, you bet. And I think this what I have to say almost goes back to what Ron was speaking about earlier in the diagnosis, and I'll just use myself as an example for the larger body of this discussion, in the sense that when I did return and I finally sought out treatment, I was kicked around, and I'll preface this with I've had wonderful experiences at the VA in New York City, and I still do to this day. I very much enjoy going there because I have such good relationships with the physicians that are there. But I was misdiagnosed, I guess you could call it, back and forth several times with official paperwork saying you have severe TBI, now you have not severe TBI, now all of your symptoms are PTSD, and then back to now your symptoms are mild TBI with PTSD. So there's need for the greater debate here, but this does rage into the idea that we are probably misdiagnosing a very large body of people that have wide-ranging issues that are being overlooked or mistreated, which can obviously lead to substance abuse in the idea that the VA can't help me, I can help myself. So again, using myself as an example, alcohol is a very easy self-medication technique. Many people do this. The lucky ones are the ones that figure it out that that's not going to work. It's going to make everything much worse. I figured that out relatively quickly, that alcohol was a very quick accelerant into much more grave things, suicide being one of them. However, too many people don't figure that out for whatever reason. But my issues with substance abuse were simply with alcohol, and it was so easy to just do that. There's people I know to this day that haven't left that trap yet, and that's why these discussions are important, because this discussion will lead to hopefully someone figuring out that it's time to go back, it's time to reevaluate their symptoms and come up with some kind of course of treatment. Again, though, in the idea of self-diagnosis, some people don't hit the substance abuse route. Some people hit the exercise route, or the route of joining a larger organization like IAVA, or some kind of facet of very healthy activities. And I think those are becoming more popular now. I think we're stuck in an era, and the era lasted to very recently, of not talking about this discussion, not talking about everything that did happen in a war, even something that happened if you were a civilian in a car accident. Just let it go, don't talk about it, it's over with, move on. I think we're becoming, as a society, much more willing to discuss internal feelings, and that's amazing. I think that's great. So I think people are awakening to the fact that it's time to talk about things, not internalize things, and I think that will, as cliched as it is, tear down the walls of the substance abuse issues that have happened.
Dustin, I think you've personally, just in that response alone, have furthered the conversation and inspired some folks listening to continue to bring this forward. When people have figured it out, or figured out that some of the maladaptive or sort of terrible coping mechanisms have not been helpful, and they turn a corner and they get on to perhaps more life-affirming. I'm wondering, there's a woman who's got a question here. Her name's Patty, and she says it's related to diet and nutrition, and I'm curious, Ron and/or Dustin, if you've got a thought about this. She says omega-3 fatty acids have helped with depression and addiction in some of the veterans that she's been working with, and wonder what your thoughts are about nutrition and TBI. I thought it was kind of an interesting question. I see. That's a product placement there, Dustin.
I think one of the
Sorry.
things that, one of the things that Dustin said, I think that just bears repeating. The issue of alcohol and substance, and I'll show you how we tie that into the nutritional piece. You know, the brain is the largest chemical factory in the body. And as we talk about traumatic brain injury, certainly the hardware, the brain, if you will, can be damaged, injured, etc. But it's also the neurochemistry. This is why some of our NFL players that sustain pretty significant concussions, we do an MRI and their brains look fine. It's the neurochemistry. You know, we have these neurons and axons and dendrites and everything that connects up, but it's a chemical process. And so when you take another substance into your body, into your brain, what we want to do is make sure it's a good substance. And so alcohol, drugs, anything like that can actually exacerbate some of the symptoms of the brain injury and certainly of PTSD. When you start tying that into nutrition and start looking at things like such as, you know, the fatty acids and whether it be, you know, fish-based products or other kinds of things, are there ways to enhance cognitive processing? Are there ways to be getting the brain chemistry, etc., working better? And certainly, as we all know, out in the world of diet and exercise go hand in hand. And the reason I like that question on nutrition is because basic psychology says never take something away unless you can put something in its place. And as Dustin said, you know, the people that will turn and go over into, say, the exercise world, or it could be the creative arts world. What we want people to do as part of the treatment milieu that we would have them in, not just the cognitive rehabilitation, and it could be OT, PT, and speech, and physician stuff, but also to take advantage of these other kinds of programs in terms of exercise, good nutritional programs, getting into those kinds of things that can help them to, you know, be more creative, building things, working on things, to start to, you know, support, in a sense, what the brain really likes to do, and that is to be out there, to be healthy, be creative. And so this overall thought about brain healthiness, there's a center in Dallas, Texas that works a lot with veterans. It's called the Center for Brain Health. It's not the Center for Brain Injury, it's the Center for Brain Health. And it's that healthy brain, whether it's veterans or civilians after brain injury, that we need to focus on. We need to focus on it from a full 360-degree circle.
Appreciate that's an important reframe. Dustin, you were talking earlier about it took a long time to begin to speak about this, and you were bringing up the subject of stigma around brain injury in our culture, and some of the challenges of being able to address that. And I wonder, and maybe this is a related question for both you, Ron, and Dustin. We've learned that traumatic brain injury is a little more difficult for younger veterans than it is for older veterans. And I wonder if, Dustin, maybe you could start by sharing what was some of the stigma, what were some of the challenges that you faced in finally coming forward, and was and is some of that a function of perhaps your own age? And then maybe we'll have Ron talk a little bit about some of the science behind older veterans and some of the difficulties with TBIs.
Sure. Again, using myself as an example, I consider myself pretty intelligent, came from a very tight-knit family, had all kinds of resources. I did not come home homeless. Let's say it like that. I still came home to a very tumultuous situation, and part of my path has been PTSD. So I would say PTSD played a much larger role in my transition out, in the lack of a intelligent transition out of the military. However, the stigma existed because we came back to a society that had dealt with very traumatic wars prior. And those traumatic wars weren't largely discussed by the people that were in them or the cultural societies that they came back to. Vietnam, Korea, I mean, you want to talk about Panama, whatever, World War II. Only recently have we really been bombarded with what happened in those wars. And I feel that when, the younger generation initially was getting out of these wars in Afghanistan and in Iraq, we were coming back to the archaic idea of deal with it when you're 80, live your life until then, which is not the right answer. It's not what we need to be doing. So that's what I came home to, the deal with it when you're 80 generation. And initially, I had no idea what a veterans group was or could be. I just knew it was the VFW. No knock on the VFW, wonderful, amazing organization, but it's not a place where you go to get treatment. It's a place where you go to, socialize, be amongst friends, etc. There are now incredible functional entities that are treating military veterans and the younger military veterans. And again, here's TBI coming in. I'm losing my train of thought here. So trying to get back to where I was, the transition home, there were so many stigmas that existed. So I had a horrible transition. And when I talked to other people, mine was quite mild. But to me, it was quite devastating. I ended up moving away from everything I knew just to put the barrier up for me to finally heal. Because my transition was so tumultuous, I was now a plague amongst my family, with the ideas of using alcohol and becoming kind of out of control. So I don't know if I really lose my train of thought. I don't know if I answered the question totally, but I did not have a good transition. There was not the functions that should have been in place. And I think that is very relative to older generations and newer generations and how we're treating both those bodies of people.
Yeah. Dustin, thank you. You're answering beautifully. Somebody has written in that I want to just add on. If I could ask you, Dustin, just to say a little bit more. It's Lois. She's from the Brain Injury Association of New York State, and she wondered, do veterans prefer only brain injury support groups? In other words, is it better for veterans to sort of help each other through this process, or is it something that could be that veterans might be open to with civilians going through perhaps similar kinds of injury?
So you're going to get two very different answers. My answer being, I want to be among civilians. I want to know what this injury looks like not in combat, because that helps me walk around every day and relate to the society which I'm trying to reintegrate into. Okay? You're going to get veterans that are vehemently opposed to being in a civilian work group because they view their injury as war-related and not a car crash or a skydiving accident or a street fight, whatever it was. But I think that's, again, I don't think that's the right answer. I think the right answer is integrating the civilian voice into this injury. Because, I mean, look at sports-related injuries. That's something we can all relate to. We all know the sport. We see the sport played out on the field, and you can watch that happen. So it's important to know that you can visualize the incident. So it's good for you to know that the civilian body can visualize TBI. It is visual. Whether it was in war or not, I think it's healthy to realize that you can see it happen, which I believe, for me, again, speaking for myself here, helped me realize that I was not, some black swan coming home to a society that had no idea who I was now. Because it's not true. This is a wide existing injury in a very wide populace on who can receive a TBI. So I'm going to go with, I think the right answer should be integrated study groups, should be integrated healing groups, and to include alternative medicines. I don't think closing each other off is going to help as much as it could if we were to integrate.
Dustin, I appreciate very much. In watching the World Cup soccer game the other day, there was a hit, and the visceral nature of seeing that, as you say, to see it in context, was palpable in my own body, and I wondered. I'm challenged by what you said. I like if civilians were to sort of know more about the context in which that injury takes place, what would be the impact on our level of support and care. So let me get Ron into this question. You've indicated that veterans of different generations have perhaps had a little bit easier time with traumatic brain injury, that it's much more difficult with the younger. I wonder if you could pick up a little bit what we're talking about now, Ron.
Sure. I think when you go back through and look at veterans issues in relationship to head trauma, you can go back over many, many wars. But it did become the signature wound in these two wars. Traumatic brain injury, and the numbers are staggering. The other thing is the length of time that these wars have gone on. I was looking at some research that was presented to NATO from Headley Hospital in England. And England and other countries that also participated in the Iraq and Afghanistan wars do not have the levels and the incidence of PTSD as American service members. And the difference is that our service members are serving not just one tour or two tours, but 3, 4, 5, 8, 9, Sergeant Corey Remsburg, 10 tours. And that's not so in other countries. And I think that's something we need to take a look at. The other thing is our troops, our service members are young. Average age for a service member with a traumatic brain injury is 19 years and 3 months. That's the time in life when the frontal lobes are just developing. It's almost like we take our most precious part of the brain, if you will, those frontal areas that turn into our adult brain, and injure them early on. And many of these young people don't have a history of living out on their own, or holding down a job, or social relationships, marriage, any of those kinds of things. They were just sort of they were either left out of their primary home, or had only been out there for a short time after. And many of them, again, came from rural areas where when they go back to those rural areas, there's not a lot of specialists. And just like with Dustin, I think that the VAs are doing a tremendous job. I know there's been a lot of things in the press that may not necessarily indicate that fully, but in the civilian world, hospitals are certainly places where people with traumatic brain injuries go in the beginning, but that's not where most of their services are afterwards. It's in community systems, post-acute programs, outpatient clinics, and those kinds of things. But for the younger service member, just to think in terms of the maturity of the brain, not only have they had a brain injury, but these are very young people. They don't necessarily even know how to raise their hand and ask for help. And so one of the points I'd really like to make, and to bridge off the question from the New York Brain Injury Association, is I don't think in the civilian sector, and this is just my opinion, I don't think in the civilian sector we have really known how to reach our service members with brain injuries. I think we've certainly put up bumper stickers and signs on our lawns and those kinds of things, but in terms of how do we really reach them? These are young people that were in the civilian sector, then in the military sector, and now need to come back into the civilian sector. There's got to be more than just putting a sign on your lawn or thanking a service member. Civilians have got to step up in a whole different way, especially the brain injury community, and say, how do we help to embrace these people and embed them in the services that we have? Because the civilian sector has a lot of services and supports for brain injuries. Not necessarily everything we need, but it would be a tremendous compliment, I think, to the VA hospitals.
Thank you, Ron. Just invite folks to continue to send your questions. We appreciate. There's a box on the right-hand side if you're interested. We'd be glad to try to incorporate those into our conversation. Justin, you had mentioned different wars have had different kind of support, both in familial as well as societal structure. And you talk about the impact that traumatic brain injury has had on family members, on friends, on people who are close to somebody who's experienced that. And so I'd be glad, both Dustin and Ron, if you could share. Maybe Dustin, you first. What has been some of the impact of a traumatic brain injury on people closest to you?
Mine was fairly simple and very straightforward, and I say that because I'm now having, for the first time in very many years, actual conversations with my family about my injury. Now, it's because I was in very incredible support groups urging me to talk about what it was like for them when I came home. I knew what it was like for me, and I could project anything I wanted to make an excuse for anything that I did. But it was important to know what was my transition like for them. And it was not easy, and it was incredibly difficult. I came close to, ruining entire relationships with my family, with the people I loved, because I came home, in such a storm. And that's happening every day. There's thousands of people coming home in that storm, and they bring the storm with them, and their family's right next to them, and the conversations aren't being had with why there is a storm there. So, I mean, thankfully these effects weren't lasting, and the conversations are being had in my life now. But again, it came close to ruining entire relationships. With for an example, coming home and you having no idea what to do with your day, so deciding that you should drink alcohol all day and not think about anything, and not even have the will to prioritize anything, and not even knowing what to prioritize. That's a negative effect on your entire family, especially when you're living with them, and they're going about their day as they have the last 5 years until the next day when you got home on a Monday. Now their life's vastly different. What do they do with you? Do they interject on your behavior and alienate you? I don't know. Do they send you to a rehabilitation clinic, supported by the VA? There's so many different options. I think it's always easier to ignore things. And I think so many families are ignoring symptoms and these blowing out of control among the service members getting home. But again, I did not get out well. It took 5 years now to really have conversations with my family in very real situations on how did that feel? How did I hurt you and why? And I didn't realize those actions were that negative. To me, I was dealing with something, and I didn't realize they were collectively dealing with me, if that makes sense.
Yeah. Perhaps I've just touched by that, Dustin, very much, just the amount of courage required to face the impact on people you care about. Thank you for sharing that.
Sure.
Ron, I wonder if you might add to some of the impact that this has on family, friends, caregivers from your perspective. Well, and by the way, we've got about maybe another 10 minutes before we wrap ourselves up this afternoon.
Again, from the civilian side, as Dustin has described, very similar. Whether it's a parent coming home, it's a child coming home, someone with a brain injury coming back to that home, the person who sustained the brain injury is not the only one that's affected by it. And it's almost like it becomes contagious. It's almost that everybody catches, if you will, the brain injury disease. And no one knows how to respond sometimes. Families don't know whether, do I encourage this person to go out, to get more help, to get more therapy, to get back to work? Do I wake them up early in the morning? Do I monitor their sleep at night? You know, whatever. And so many families, what we do is we just hope that if we have a little bit more time on our sides, then it's just going to get better on its own. And unfortunately, that's not usually the case. Certainly sometimes that does happen, but you need some level of guided intervention, if you will. And that's where I do think that on the civilian side, we've been able to figure out some of those services and supports that we can provide people with brain injuries that can help them to slowly reintegrate back into the world. When I talk with veterans with brain injuries or civilians with brain injuries, I hear this story over and over again. I went back home. I didn't feel like myself. I didn't feel like anybody understood what was going on. I sometimes could explain things, but I couldn't figure out what to do about it myself. Or sometimes I thought I was okay, and I wasn't. But this tremendous loss of sense of self, of who we are as a person, that's exactly the impact of traumatic brain injury. In fact, I think that, you know, and I'll say this in terms of my own clinical opinion, having worked, you know, with a lot of people with brain injuries, you know, you can go out in the world again and not walk as well as you did, or not talk as well as you did, or not remember as well as you did before. But if you don't have a sense of self, of who you are and what you can do, and confidence again and everything else, that's probably the greatest loss. And that's exactly what brain injury robs of people. It robs us of our sense of self. And that's, I think, where we have to start, you know, as family members and people out in the brain injury world, to start to build that sense of self for the person again, so that these other kinds of things can have a more lasting effect therapeutically.
Thank you, Ron. Just two final questions. Dustin and Lana, just give opportunity to have you share a little bit more about in your work role at IAVA, and you're talking about these kinds of issues. Maybe just share a little bit about what you've been doing in your life related to this lately.
Sure, you bet. I pretty much got into finance pretty quickly out of school, and I mean, that's an incredible industry. It's vast, and the opportunities in finance are endless. However, there was a greater calling, more or less, to get back into the veteran space, because I knew how much it hurt getting out, and I knew those processes in place. So I decided to get very quickly back into the veteran space. So what I've been up to now is, you know, my role at IAVA is strategic partnerships, and that's building, you know, mutual relationships with larger corporations or other nonprofits or like-minded people, in having them support our cause and us supporting theirs. So it's strategic in nature, and that's what I do every day. But with that comes speaking about everything related to a veteran. And TBI is definitely coming up more. PTSD is coming up more. In fact, I'm not even sure if we're calling it PTSD anymore. We might be calling it PTS. So you know, these are things that we all deal with. Everyone that works here, everyone that works in any VSO is probably having these conversations now. And it's incredibly important. So I might have a role of strategic partnerships, but that doesn't excuse me from having a role in anything related to a veteran. And I realized that very quickly. So I think it's very important working for an organization like this. I think it's important in anyone in the field doing anything related to injuries like this, because they're not specific to veterans, but they're very prevalent among them. So it's duly important. But that's what I do. I'm very passionate, very motivated to be here. I love it here. And I love the idea that, you know, I hope someone gets help today. Who knows what's going to happen.
Thank you very much, Dustin. And a question finally to both of you, just as a closing remarks, just recommendations for folks that may have experienced traumatic brain injury athletically or as part of their military service. What might be some of your words of wisdom at 3:55 p.m. on this Monday in July.
Well, I think that Dustin has described all those pieces. You have certainly heard, and I appreciate his story, that it's not just one discipline. It's not just the physician or just the family member or just the therapist. It takes a team of people. And we've learned this in the civilian sector in terms of brain injury. It really takes what we call an interdisciplinary team. Medications alone are not enough. But the other thing is when I listen to Dustin talk and other service members like him, there's those basic things in life. You know, a safe place to live, meaningful work to do, and people who care whether you live or die. You need to start with those basics and then build the programs there and build the therapeutic interventions. But for heaven's sake, don't just allow the person to just do what I call the wish and hope program. I just wish as time goes by and hope that they're going to get better on their own. Traumatic brain injury, there's a lot of good interventions, a lot of good things that we can put into place, services and supports. And from the civilian sector, we need to reach this population with our knowledge base and the technology that we have, and to help facilitate their reintegration back into the world.
Well, I want to be a good timekeeper. Thank you, Ron. If you would like to know more about traumatic brain injuries and the work that the IAVA is doing and the work that the Traumatic Brain Injury and Emotional Wellness Alliance, our websites are easily at the IAVA.org and the Mental Health Association of New York City under one of our programs, the Traumatic Brain Injury and Emotional Wellness Alliance. We will also be sending you a link. This has been recorded today. It'll be available on YouTube upon the conclusion of our time today. You're welcome to view that and to pass that along to folks. And if you'd like to know more, please just check your email. We'll send you updates on our doing this again. This was the first webinar for us to do in our collaboration with the IAVA, and again, honored to share this stage together with folks at the IAVA. So, Dustin Sharrock and Dr. Ron Silver, thank you both very much for sharing your time and experiences and expertise with us today, and we hope to speak with all of you folks again. Thank you for being with us.
Thanks, Scott.